But I think हिंदी इंग्लिश मिक्स करके भी बोल सकते हैं आप. और अगर हमारे सुनने वाले 2:30 बजे के बाद सवाल पूछना चाहें तो वो सवाल किसी भी ज़बान में पूछ सकते हैं, बिकॉज आई विल स्पीक English and Punjabi and Hindi and can translate it for both of you. So, Dr. Patel, let's talk to you. So, you were born and brought up in Malawi.
Hmm.
What a beautiful place.
Yes, near South Africa.
That's
for
right.
Better context for people. It was a British colony.
Hmm.
So, born there and early education there.
Right.
And then moved to Britain,
Uh-huh.
where I went to boarding school and then on to university for my medical degree in Scotland.
In Scotland?
Aberdeen University, yeah.
Aberdeen, okay.
Yes.
Now, parents must have been in Africa for a long time then.
Yes, yes.
So how many generations?
Actually, my mother was born in Africa too.
Okay.
Yes, she was born in Uganda. My father came from India.
Right, okay.
Yeah.
So, medicine, why did you get into medicine?
Well, ever since childhood, I really wanted to help the poor people, believe it or not.
Really?
Yeah, I had a very interesting experience. The first day when I went to university, they asked us why we wanted to become doctors. And 95% of the class said because either their parents were doctors or they wanted to make money.
Right.
I was the only one who put up my hand and said, I want to help the poor people. And everybody just looked at me like, really?
Where have you come from?
Yeah, exactly. Yeah.
And you've been practicing now for quite some time in Canada.
Total practice is 44 years, but in
Wow.
Canada since 1990. Yeah.
Beautiful. And Ramya is a physiotherapist and she works with back and body wellness center.
Yes.
And a physiotherapist. Now, the reason why I brought both of you together is medical field, right? So tell us something about yourself.
So I'm Ramya Vinod. I am basically from southern part of India, so which is the Chennai, as everybody knows, like
Yes.
Chennai. So I was actually born in Maharashtra, Pune, but I was brought up in Chennai, and I did all my schooling and college, everything in Chennai. And then I was a lecturer back in India in physiotherapy field.
Okay.
And I was working also in Malaysia for a few years as a lecturer. And then from Malaysia, we moved here to Canada in 2012.
Oh, wow.
So I have a total experience of around 20 years in physiotherapy, and since 2017, I'm practicing here in Canada.
Now, both of you know of each other, but had never met each other, right?
Yes.
Yes, and it's so good to meet each other face to face.
I remember Dr. Patel said to me, there is this young woman that you've got to meet her. She is fantastic and you must talk to her. And I thought to myself, what better way than
of connecting
this?
on.
And then you also told me that you loved what Dr. Patel was doing and that you wanted to talk about this. And the topic that I thought both of you and all three of us can talk is women's health. Because I think women usually don't look after themselves. They look after their families. So if they're younger, they look after their parents and mom and dad and their siblings. When they get married, they look after their husbands and their children. And I think women are the last people to look after themselves. Am I correct in saying that?
That is absolutely correct.
Yeah.
Yes. A mom kind of juggles with a lot of balls, and she tends to ignore her own health at the cost of, family upkeep, etc. And we would like to, I'm sure Ramya will agree, we would like to make suggestions how they can also look after themselves because this country gives us wonderful opportunities, without having to pay for your self-care.
Right.
And even if they do the minimum, that is, for example, women to go for regular pap smears, at the moment they recommend 3 years.
Right.
And I think that's easily doable. After the age of 40 to go for mammograms, self-care like that.
Yeah.
And I'm sure Ramya has a lot more to say about post-delivery care, which is very important.
That is the most important one, I think, yes.
Yes.
Ramya?
Yeah. So mostly, if you see, like, those days, women were delivering like 10 children, 14 children, and didn't
Yeah.
have much issues.
No.
But nowadays, if you see, because of our lifestyle, that we don't eat nutritious food, we are always in go, 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 and we don't have enough exercise and self care. After delivery, there is quite enough damage done to women's body,
Right.
which we often ignore because our focus is only on the baby once the delivery happens. So eventually, after the second pregnancy or even the third pregnancy, when things get worse, that's when women wakes up. Okay, something is wrong with my body. So I was just talking to a doctor telling that I wish women are more preventive. Like they have to wake up before things arise, not wait until everything becomes worse.
So when we announced that we were going to be talking to both of you, I had a couple of questions that people sent me, and most of the people probably would like to call in and ask you questions, and we'll encourage that, but we'll do that after 2:30. But let's take a short commercial break, and I will ask you my very first question, and let's see if we are all on the same wavelength.
Yes.
Right?
Yeah.
Okay. Short commercial break, and Dr. Surekha Patel और रम्या विनोद आज हमारे studios में हैं, and we're talking about women's health. So a young woman, I don't know how old she is, but she sent me a question, and she said, sometimes it's difficult for her to control her pee, and because you and I had talked and we'd done a television program earlier, so I became half a doctor, and I asked her. I said, "Have you had any children?"
Good.
And she said, "Yes, I've had 3 children." Or one, no, she said, no, I have 1 kid, but she said the same problem with her sister-in-law who's got 3 kids. So I said, okay, I'll ask this question from Ramya and from Dr. Patel. So is it a gone case as far as she's concerned, and she has to wear a diaper or something like that?
Okay, that's a very good question, and that's exactly what my specialty is. I have done a specialization course on incontinence. Okay, that is called incontinence. The incontinence can be of 2 types. One is urge incontinence, another one is a stress incontinence.
Okay.
So if somebody leaks urine when they cough, sneeze, when they are jumping, or even during intercourse, those are all stress incontinence. Urge incontinence is somebody who is unable to hold the pee, and they rush to the washroom. Most of the time, when they reach the washroom door,
Yes.
they leak.
Yes.
These are the 2 types, and some can be even mixed. It can be stress as well as urge incontinence. So these are quite common after you deliver a baby, and most often some women also have during the pregnancy, which sometimes considered to be normal, but actually it's the right stage where we can start fixing. So if a woman has a leak right from the pregnancy time, so it is good idea to start strengthening the pelvic floor muscle, which is the muscle which can hold the pee. If it is weak, it can cause leak. And also there is nothing called gone case. So to just quote an example, I was able to help a 85-year-old patient who was wearing 4 diapers a day.
Oh my God.
From which we got down to 3, then 2 and 1. So I had just requested her to continue wearing 1, just because I don't want her to have an accident and maybe rush to the washroom and fall.
Yes.
But she is able to control it well at the age of 85. But it cannot be possible for everybody.
Yes.
It depends upon which stage you are, and how bad is your condition, and how bad is your muscle, and topmost, how much are you able to understand what I'm telling, the exercises? Are you able to squeeze the right muscle, and are you able to exercise and put your effort on it? Then it can be quite fixed.
So how come people sort of don't talk about this that openly, right? I mean, they think कि किसी को बताएंगे तो पता नहीं क्या हो जाएगा, लोग क्या कहेंगे, किसी और के साथ ऐसा नहीं हो रहा, सिर्फ मेरे साथ ही हो रहा है. That's not the case, is it?
But unfortunately, क्या होता है, like even if you tell it to somebody, most of them don't even know that there is fix. They don't even know that it can be treated. So either they say हाँ ये मेरे साथ भी होता था, this is common, or they say हाँ ये ऐसे ही होता है, it is
होता रहता है,
just wear a pad, or what is hurting me is even people don't know which type of pad you should use. They use the regular sanitary pad, which is for the periods,
Yes.
which is not meant for the urine leak. They end up having rashes, and so many fungal infections and whatnot. But still, they don't want to just speak about it.
Oh my God. Do you ever get a question like that? You must have.
Oh,
you're,
all the time.
Yeah.
Incontinence is for all the women, regardless of race or,
Yeah.
culture, etc. And pelvic floor, actually, I have to say that the Indian culture, especially Ayurvedic medicine, the care that they gave, the herbs they used to rejuvenate your muscles, etc., is we have one of the best philosophies of looking after yourself. When I compare allopathic and Ayurvedic medicine, even naturopaths now, excuse me, it begs the question, women need to know that when they are pregnant, under the influence of hormones, your muscles and ligaments become looser. It's natural to allow the baby's head to come through the pelvic region. And it is simply a matter of, after the delivery, working with herbs and exercises to tighten those muscles. And no problems would pursue. Now, in the olden times, we had daibais who knew how to teach you do your pelvic exercises. They gave you massages, etc.
Right.
Your mother-in-law gave you herbal, what they call, at least in Gujarati, they call it katlu, and in Hindi,
Pinya.
Pinya.
Yeah.
That's right. And believe it or not, I even tell my Western patients to take it and where to buy it from, because they don't have anything like this. Postpartum, to strengthen your ligaments and your muscles, you need both physiotherapy or pelvic floor exercises and herbs to bind, knit your bones back together. It is so important. So in the name of modernness, and of course, like Ramya said, a mom is so focused on the baby, etc., that they lose sight of looking after themselves. I'm not blaming them, but I think they should give it particular attention.
I think आपने बहुत सही बात कही कि we have to pay attention to our own bodies. अगर हम अपनी सेहत का ख्याल नहीं रखेंगे and we get sick, तो हम औरों की देखभाल कैसे कर सकते हैं? So for a mother, and I think it is in our scriptures as well, if you look at it, that you have to first get strengthened yourself.
Yes.
And
absolutely.
then you can help others,
Yes.
right? So, लेकिन आजकल की दौड़ में, जबकि हमको पैसे भी कमाने हैं, कार्बन टैक्स भी पे करना है, बाकी टैक्सेस भी पे करने हैं, so we really don't take any time for ourselves, either हमारी exercises के लिए और हमारी चीज़ के लिए. तो if we are in that sort of a situation, what would you suggest to women कि सुबह वो उठती हैं, 6 बजे उठ जाती हैं या 5 बजे उठती हैं, and they're going to look after their kids, स्कूल के जाने का खाना पका के, and then get everybody sent, then she rushes to work, and then she comes back and she looks after everybody else. By the time she goes to sleep, it's about 11 o'clock or midnight, and then she's up at 5 o'clock again. How can, in that sort of a busy schedule, can she find time for herself?
Yeah, that's a good question. And also, while you
A
were
long
telling,
question.
while you were telling that, something came into my mind. Just like flight mein jo bolte hai na, when there is an oxygen deprivation,
That's
first
right.
wear your mask and then help others, right?
Right.
So similarly, women often, once the baby is born, her complete attention is on the baby,
Right.
and she feels like she's gone from the from the picture. So well said. Like yes, women are running on the go. They are busy work, chores. Like in Canada, we are everything, right? We are the maid, we are the cook, we are the plumber, electrician. So what happens is like as you said, like gradually her body deteriorates because of the excess work, doing all the chores by herself and running for the work. So the exercise what I'm giving in pelvic floor exercises will usually be very, very simple one where she doesn't have to separately allocate a time for this. So there's not going to be like, oh no, put a mat, go sit in a place, wear the the exercise
Chola
suit.
pehan ke.
Yeah. So it doesn't have to be like a stereotype exercise.
Right.
It's just going to be like the way of life. Like
Okay.
while you are doing this, you hold the pelvic floor and do it. So if you're bending and picking up your kid, can you just tuck in your core and the pelvic floor and then pick up the kid? So those can help in preventing the back pain. But often women always put the blame on the epidural. She always say, I think I got the epidural during
So
the
did I. I
yeah.
got the epidural.
They always they always say because of the epidural is the pain. So now the researchers have proven that epidural doesn't cause pain. It is a weak core muscle which the women don't strengthen after delivery is the one causing the pain. And as doctor said, the traditional way, we always forget the tradition and all run behind the modern stuff. Do you remember we used to tie our belly after the delivery? Here, of course, in Canada, doctors don't recommend that, but it does bring your diastasis, the gap you get after the delivery. tummy में एक gap हो जाता है, उसको बोलता है diastasis. So that can reduce if you just wear initial few weeks and help it close. And another research has proven that breastfeeding will promote muscle healing faster.
Definitely.
So
I am a big advocate for
For breastfeeding.
breastfeeding.
Yes.
Absolutely. See, nature has tailored it.
Yes.
And it has been proven again and again that if a woman breastfeeds right up to the baby's age of 1 year, regardless of weaning them, she herself will not even have to go on a special diet to lose weight. By 9 months, she will have lost and gone back to her 20-year-old, when she was 20 years old weight.
No
If-
kidding.
Yes, if she will follow it religiously, and the babies are so plump on their milk. So, the way the hormones work,
Right.
like Ramya said, breastfeeding is very important. It's very important. I will also like to add to her simple exercise routine. If a mom is feeding something simple as feeding the baby while lying on her side, she can breastfeed the baby at the same time. Just bend her knees a little bit and do her pelvic tightening exercises while she's breastfeeding. It's as you count it up to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let go of the muscles. So it's such an easy thing to do. You can just do it.
Do you think कि हम इसलिए नहीं करते because nobody has taught us? Because number one, we've left our homes.
Yes.
वहाँ पे we had families together, सब बैठ के माँ बात करती थी या सास बताती थी या आस पड़ोस के लोग बताते थे. But here, number one,
you're isolated.
And not only are you isolated, I also feel that even if you come into a family here, you are an outsider. And that's another issue for women. I want to talk about that later on. But that's an issue that I feel hinders the women the most. Because वो किसी के साथ शादी करके उनके घर में आई हैं अपना मायका छोड़ के. And so there is no relationship there. So probably she can't even ask anyone any question.
Yes, and younger girls these days have their own mind. So I will, there is the other side of the argument.
All right.
Even if the mother-in-law says,
yes,
I've made you these piñas or whatever, they're like, oh no, ye to aajkal nahi khate.
Yeah.
So that, there's a part to that too. So we have to bring it all in perspective for everybody.
Okay, so there are two sides here now हमारे सुनने वालों के लिए. एक तो वो साइड जो कि बहुत मॉडर्न हो चुके हैं और चाहते हैं कि हम पिनिया शिनिया नहीं खाएंगे बच्चा होने के बाद क्योंकि we'll put on weight. And the other ones are कि this is something that is going to help you in long run. Do it, try it. And if you have any questions for Ramya and Dr. Patel, you may call us right now at 604-280-1200 or 604-299-8, right?
Yes.
And so if people wanted to come and see you, they can come and see you in Surrey. Are you located in Surrey?
Yes, I'm located on Scott Road and 82nd.
Okay.
12057 and 82nd Avenue. It was right beside the IHOP, which is on the Scott Road.
All right. आप वहाँ पे आई हॉप खा के आओ फिर मुझको आके मिलो. All right. And if they wanted to talk to you, we've got their telephone number as well, 604-594-3808. We'll take a short break and we'll be right back. जब सुन रहे हैं बुधवार का दिन है, मार्च महीने की पहली तारीख है, and every first Wednesday of the month, if Dr. Saiba and Ramya both have time, we want you both to come into the program and talk about women's health. And there are a lot of things that we want to talk about. Just now we were talking about after pregnancy and after delivering your first or second or fourth or 10th baby, not anymore. People don't have 10 babies anymore. In our good old days, we did.
2 are like 12 these days.
So how can a woman keep her body fine and healthy and also look after her whole family, but look after herself as well? There are many women who feel that, okay, I have this issue of, what is the word called? Prolapse, right? So, कोई बात नहीं ठीक हो जाएगा और नहीं ठीक होगा तो we'll have an operation. So, what is wrong with this statement?
Well, operation is not the answer because you will find invariably after a few years you're back to square one. And sometimes you still have, if you have stress incontinence, you're coughing, etc., your mesh can tear, break up, so you can begin leaking. There is in my personal, even if you have an operation, tightening your pelvic muscles with exercises is a must.
Because when you are doing an operation, you are obviously doing an invasive maneuver,
Yes,
right?
That's right.
Rather than doing it yourself to control your own. Rami?
Yeah. So again, to just add on to the point, I also have heard from many women saying that people who have normal delivery, they have issues, or people who have C-section have issues. They think that the other person is free. Like there is nothing like normal delivery, no issues, and C-section has issues. Both can have same issue, no matter what is mode of your delivery. So other point, what doctor said, yes, surgery is not the permanent fix. So what happens is, like if your bladder or uterus is out of the vagina, it is called prolapse. And if they think lifting up it with a mesh surgery is going to fix, it's not. We first have to address and find out why on the first hand you had that prolapse. So why you have been pushing everything down. So what made that prolapse actually happen? We first have to address that. If not, as doctor said, mesh is going to tear again. So I have seen in my personal experience a patient who has done 5 surgeries for the same issues. 5. So every time they do, within 4 or 5 years, the bladder is down again. So why? Because she has not just done one thing, strengthening the pelvic floor and not pushing it in day-to-day life. The same sentence which I told before, a woman, if she is bending down to lift the baby, how do you lift the baby without pushing your bladder down is more important than you just doing other exercises.
Now, when a woman gets pregnant, obviously the body is made in such a way that the uterus and then the bag in which the baby is, growing becomes bigger. Does it push on all the other organs?
Yes, it does.
Yeah,
it
and
does.
then?
And then also the hormone progesterone.
Right.
It loosens your ligaments in your pelvis, so your pelvic floor muscles also become naturally loose to accommodate the passage of the baby later on, when you're giving birth. Sometimes deliveries are done in a hurry, so the midwives, doctors, but most deliveries done by midwives.
Yeah.
And a lot of babies are pulled out. And sometimes not in conjunction with when they tell the woman to push. So they pull the baby out, so they're pulling down those already loosened, naturally loosened muscles
Yeah.
in the vaginal and the pelvic one. So that can also cause prolapses. So there's a lot of, man-made causes also,
Also, that
which are rectifiable,
right.
like Ramya said.
Yeah.
So I would like to add a very valuable point here, as like we are talking about after delivery, right? All these problems, like as doctor said, the prolapse during the labor can be preventable. And often many women end up having C-section after trying for a labor. They just push for a long time and then they go for C-section. And sometimes the doctors have to use the vacuum or the forceps. Most of it, yes, of course, it's because of the the size of the pelvis or all those things, the size of the baby, or maybe the head of the baby is not in the front. All those things put aside, there is another reason, is the way they push. Nobody is teaching women how to push during labor.
I so agree with you.
Yes.
Quite a few years ago, when I first came to Vancouver, joined an Indian practice, a practice with Indian doctors, and they were all male doctors. They unfortunately did not advise the women anything about labor, anything about muscles,
Yeah.
And I was horrified that these girls had no preparation whatsoever before delivery.
Yeah.
And these girls were so young, they'd go for delivery, and this is no exaggeration. They'd all end up in cesarean section because the girls had no idea what to do. And even at the last minute, the urge when the head is supposed to come out, the girls would close their legs tightly and not allow the baby to come out. This is ignorance. And the baby's heartbeats would drop so badly, and finally the obstetricians had no choice but take them for cesarean sections. So a lot of cesarean sections in this country, especially in Surrey, amongst our women, was done because these girls were not prepared at all.
Oh my God.
I was horrified. I would prepare every girl and say, this is called labor. There's a reason why. And what do you do during labor? I would already start teaching them breathing techniques while they were pregnant. How to breathe when a contraction comes on, etc., etc. So already by the time they're like 4 or 5 months, I would teach them, I want to practice your breathing techniques from now till your delivery. And labor means labor. It's hard work. Labor means hard work. Okay? But you will not have a cesarean section if you really follow the techniques that we tell you.
So, isn't that interesting? So, why wouldn't a family physician tell their patients, especially women who are having baby for the very first time, that this is what you need to do or prepare you for that? But I must also not just blame them. I will also blame our community, which does not allow women to go and talk to anybody. Ramya, would you agree with me on that?
Totally agree with you. Nowadays, we think internet gives everything, we can find all information in the internet, and we think we know everything. So that's exactly where the problem is. Like when you already think you know everything, you're not going to reach out to anybody, and they watch some videos about the labor and stuff like that. They actually get misguided. So that is one thing. Second thing is there were antenatal classes happening before COVID everywhere. Nowadays, that has cut down. So I really wish that antenatal classes like that during pregnancy, those classes start again. And even if they start, they have to talk about labor, as doctor said. So whoever comes to me during pregnancy, my first concept of treating them would be teaching them breathing and how to relax their pelvic floor, and which stage of labor they should be actually pushing, and which stage they have to stop and not push. So this can actually prevent prolapse. This can prevent tears the tears in the vagina, and this can prevent C-sections and also complications. Yeah, and also complications for the babies. Like as doctor said, the BP can drop, the baby can suffocate, and they may have to do a quick procedure to quickly take the baby out. All this can be prevented when you learn stuff during pregnancy. So at the labor, during the labor, when you're already in pain, when they say like breathe in, breathe out, breathe in, breathe out, like you're not going to understand anything because you're in excruciating pain. So that is why you need to start practicing as early as 5th month or 6th month, so that they get used to the breathing time and they know they are ready during the labor, they are confident.
And I have to say, I mean, I'm not disparaging. All male doctors are ready to explain, but just our society is such, it hasn't encouraged. The girls don't ask male doctors the questions. If it was a lady, then they have billions of questions. But, there's a discouragement, and I'm sure the male doctors would be more than happy to help them if the women came forth and asked. Because, sometimes it's viewed as if the male doctor asks too much. The girls are like, women are backing off. Like, why is he asking me so many questions, And so they back off too.
That's right.
And so then that's not proper care for the women.
Either.
Right? Either. So it's a loss on both sides. Yeah.
I want to ask a few questions on how can people sort of become proactive about something like this, and what are the steps that they should take. But let's take a final commercial break and get the program paid for, and then we'll come back and talk to Radio Room Gupshup का program है. Dr. Surekha Patel and Ramya Vinod is in the studios today, and this is one of our very first programs on women's health that we want to continue. And Ramya is with Back and Body Wellness Center, which is in Surrey. And if you guys want to write her telephone number down, it's 604-594-3808. And Dr. Surekha Patel is a family doctor and dying to retire. They're not letting her be retired. I am sending people to her and saying, please, inko bhi dekh lo, and so on and so forth. But if we go and talk about cultural nuances, I know that, Ramya, you are talking about, how to prevent us from, going towards operations, but correct our bodies while we can, right? Not letting it go. Dr. Patel, we were off the air talking about, cultural differences between having a child and how we treat our kids. I think in today's day and age, I would like to believe, I've been here for 50 years, I would like to believe that 50 years ago, women who did not want to have a girl child because it was their fourth or third or second,